So now we are here with Trisha. She's the one of the occupational therapists here at Easter Seals in Meriden. And I'm really looking forward to talking to you because you do a very interesting aspect of Easter Seals, which is the driving assessments, basically, right?
Yes.
Which basically takes anyone who comes here or who has a disability, correct? Whether physically or neurologically, right?
Correct.
And assesses them whether they will be able to drive or not, right?
Yes.
So how does that work in a nutshell? I mean, how would you describe that to someone?
Basically, it's a medically based assessment of someone's capability of driving and if they need any adaptations or recommendations for driving. So it can be anything from, you know, is my child ready to drive? I'm worried about their judgment and their vision. Or is my grandfather who has dementia still capable of driving? So, and everything in between.
Oh, wow. So it's a spectrum.
Huge.
So it's not just getting the license, it's can he still drive?
Correct.
Okay.
Or go back to driving
Or go
after
back.
a stroke or a spinal cord injury.
Wow. Is this a new technology or, I mean,
No,
has it been around?
they've been around. Driving assessments have been around for a long time. Our previous driving instructor who worked in the building was probably in the field of driver rehab for over 30 years.
Wow.
And our current engineer has been in it for over 30 years.
Wow.
So it's been around for a long time.
Okay. So would you work with the engineer when you assess someone? I mean, or how does that work? Are you the...
Basically, I'm the therapist who does the clinical part of the assessment.
Okay.
So anything regarding vision testing, strength, range of motion, coordination, reaction time, judgment, cognition, memory. So it's very medically based.
Yeah.
And if someone needs adaptations to their vehicle, then our engineer, has background in mechanical engineering, electrical engineering. He makes sure that the adaptations that are made are made correctly.
How utilized is this? I mean, is it only for parents who see, you know, I really want to make sure my child's ready for this, or I want to make sure my grandfather can do this kind of thing? Or is it really referred in hospitals by doctors and stuff? You know, oh, they just had serious knee surgery. I want them to go to Easter Seals and test this out. You know, how utilized is the service?
It's very utilized. We do 2 assessments a day, every day. It's a full-time program here. And it varies in terms of where the referrals come from. Like you just said, it could be a doctor who has a concern. It could be a family member. It could be, you know, someone from ASRC suggests, you know, that it's come up a few times that there's a concern or a question from a family member about someone's readiness, and you're not sure to take that next step into driver's ed because it's such a financial and time obligation. So
Right, yeah.
it could be any of those reasons.
Wow. So this is obviously something you would do before if they're younger, you know, if they're 16, they'd come here and then they'd go do the real test as everyone else does, correct?
Oftentimes that's the case. It's a sort of precursor to driver's ed, but sometimes someone's in driver's ed and they're struggling, or they've had a difficult time passing the licensure test. You know, they've taken it 3 times and they don't understand what the problem is. You know, or even they've gotten their license and they've had multiple accidents in the family, or the physician is sort of concerned. So it could be all of those reasons. And we have such a team approach between the therapists. We also have a driving instructor, I neglected to say that, on staff full-time as well. So
this is not just to assess and say you pass or fail. This is to help. This is to get everyone to a driving level.
Absolutely, unless they're not capable. And
Obviously,
then, and then we try to be honest on that and make recommendations for public transportation or alternative transportation. But yes, ultimately our goal is to seek out someone's readiness and what they need to be safe on the road.
Is that hard to tell someone they didn't pass? I mean, that's a part of humanity these days to drive. Am I right?
It is.
Is that hard?
It is hard, but at the same time, often the families are involved and they sort of already know the answer.
Yeah.
And with a supportive family, it's really not as bad as if it were someone just on their own then trying to figure out how they're going to get everything done. So with the right circumstances and support systems, actually it's not that bad. I get asked that question a lot. Not a terrible thing you have to tell people.
Yeah, can't drive.
But it's for their best interest. It's for their safety, public safety. So if that's the way it goes, you know, it's...
Okay. Why, for you personally, why are you in this program? I mean, why work with people with autism and other disabilities? Why is it special to you? You know what I mean? You could be elsewhere, obviously. You could be working at a facility with just people who always get in car accidents, that kind of thing. But why is it special for you? to be working with kids and adults with disabilities?
I really like the field of occupational therapy specifically because it's so diverse and we can work in various settings.
Mm-hmm.
You know, I started out in rehab, worked with spinal cord injuries, you know, transitioned to things like aquatic therapy and assistive technology. But the driving was a nice fit for me because I really do enjoy the full gamut of assessing, from vision to cognition to physical skills. So I really get to use my evaluation skills. And I love technology. Like, I also have a certification in assistive technology. So I really like problem solving and figuring out, you know, how can we help someone, especially someone who's significantly physically disabled, continue to operate a motor vehicle through adaptations and engineering. Like, to me, that's just really interesting.
Yeah. It definitely is. What would you say is the most amazing story you've had, specifically with the driving assessment? You know, maybe someone who's improved the most, but what would be that one story you'd want to tell people and that makes you kind of proud?
Oh, that's so hard. There's so many.
And obviously not using names, but I mean, give an example that maybe could be broad to cover a couple of the stories you've experienced, but what makes it so special?
I had a young woman once who had a significant brain injury from an accident, and she's really struggling in her road to recovery. And in terms of, you know, it's a huge life change to you know, be able. It affected her speech, it affected her mobility, and she wanted to drive and get back to work. And she came through the program a few times, and every time she came through, we had other suggestions. Well, you're not quite there yet. You need to do this. You're not. And she'd be so upset, and she'd be crying. But by that, she did everything we told her to do. And by that last time, I would have hired her as a driver. As my driver. Touch my microphone. She was wonderful. So she did. So that was a great success story. And you know, you think every time she came through, she was so disappointed, but in the end, she did beautifully.
Wow.
So that was nice.
That's amazing. I mean, I think I was looking on the website last night, and I don't think it's specific to this Meriden one, but I think it was in Connecticut somewhere, of a story. It was Maurice Snell, and it was a little video at the bottom of the page, and it was saying how he had a lot of, I think he was autistic, I'm pretty sure, and he had a lot of social troubles. And one quote, I believe the mom said, was that Easter seals brought a lot of him that was already in him. So it's not that you're teaching them things they never knew that was never there. It's inside them. It's bringing it out. You know what I mean? And I think that's the unique part about this. In OT, occupational therapy, and physical therapy, I mean, would you agree with that?
I would. Yeah.
It was a very profound statement. I found striking because you don't think of it. Don't think of it that way. Now, in Maurice's story, I noticed that they said he ended up working at Easter Seals. I mean, I know you don't know the story specifically, I assume, but does that happen, or is that at other Easter Seals? Like, you're branched off of Waterbury, correct?
Correct.
Kind of the headquarters of this area. Is that how it works, or?
Yeah, Easter Seals is strange. We're all under the national Easter Seals, but we're sort of individually managed.
Okay.
So our management comes from the Waterbury office.
Okay. So do they have adult employment opportunities? Do you know what I mean? Or are you not aware of that? I'm just wondering if is that a service Easter Seals offers?
Well, the programs in Waterbury and soon to be here, we actually do have employment services. It's sort of a vocational program for various disabilities and people with disabilities. So there are vocational services. I mean, specifically, were those people who were treated by Easter Seals? Probably. I'm sure there are cases.
Yeah.
You know, I have clients come in to see me and they're like, oh, I was here for therapy, or oh, I was, you know. We've had, you know, many stories, I'm sure, similar to that. And so I'm sure it exists. Specifically, do I know all the details? No.
Okay. Well, I suggest everyone check out the website. I enjoyed looking through it and really liking it. And I can't remember it off the top of my head, but hopefully they'll put it at the bottom of the screen. But I enjoyed reading all the stories, and I'm sure, I mean, you see it every day. You and Carrie hear stories every day, and it was just amazing and eye-opening.
Absolutely.
And I'm sure you know, I was talking to Carrie, and she clearly loves her job, and I can sense that about you too. It's not necessarily work. Maybe the paperwork part, like Carrie was saying, but
I like that part too.
Well, not every, but it's just a nice environment here.
It is.
Well, I mean, I look forward to looking at the mobility assessment.
Great.
Hopefully, we can see some people on it. And
excellent.
All right, thank you so much for talking with me.
No problem.